Doctors say the Johnson & Johnson vaccine has been a game changer as the one-and-done dose. However, a few states, including Georgia, have seen some patients with temporary adverse reactions. Our Kenesha Dees has insight from doctors on why this vaccine is still safe.
So far, the data doesn't show that they're true adverse reactions. The symptoms have been lightheadedness or fainting. So those are common with injections in general.
At least 40 cases of unexpected reactions to the Johnson & Johnson vaccine occurred at sites in Georgia, Colorado, and North Carolina. However, the CDC says an analysis reveals the CDC, quote, did not find any safety issues, end quote. Health departments in Georgia and Colorado say people, quote, should not be concerned, end quote.
Might just be that, if you do 1,000 vaccines, you're going to have 1 or 2 people. So it feels like a lot.
For those on the fence, here's what doctors recommend.
To those people that are considering the Johnson & Johnson vaccine to still consider it, that they haven't pulled it, they haven't said that there's enough risk.
Doctors say fever, headaches, and body aches are some common side effects. However, they also say to weigh your risk when it comes to deciding to get the vaccine or not.
Look at the benefit and risk. If it is the benefit outweighs the risk, then I think we should continue, because the risk of getting COVID is you can end up dying from COVID.
Shaw says to tell your healthcare providers if you're prone to fainting before receiving any vaccine.
The Johnson & Johnson, Moderna, or the Pfizer, let the healthcare provider that's vaccinating you know, and they'll probably have you stay seated for longer and make sure that you eat and drink well before your vaccine and that you're well hydrated and that you have time to rest.
Putting the Valley first, Kenesha Dees, WZDX News.